The area that makes up the Illinois Valley is home to some of the greatest farmland and scenery in all of Illinois. Located just 90 miles from Chicago, the area captures the best of both worlds. Residents of the Illinois Valley enjoy the benefits of a smaller community with all the advantages of big city life nearby. For nearly 100 years, residents of the Illinois Valley have also benefited from the quality care provided by Illinois Valley Community Hospital. From its beginnings in 1914 as People's Hospital to the merger with St. Mary's in 1976 when it became Illinois Valley Community Hospital, IVCH has grown with the community while caring for generations of families. This bond between hospital and community is especially appreciated by longtime resident Harry Erlenborn.
I am 93 years old, and I have always seen the community support the hospital, and in turn the hospital always tried to support the community through various programs and so forth. Now we have a new campaign underway, and I certainly hope that once again the community will support the program 100%.
Growth at IVCH has always been linked to the growth of the community. Each decision to expand or add a service was measured against the needs of the community. Dr. William Farley has witnessed tremendous growth and personally delivered several generations of local residents through his OB practice.
We do need a new department in order to keep up not only with the environment of the mother and the comfort of the mother and the comfort of the family, but also in the comfort of the baby. All two individuals must be considered.
I have seen the plans. We've been talking about this addition for 15 years, and now it is arriving, and we're so thrilled. I've seen the plans. It's going to be beautiful, and it's going to be very inviting for the mothers and their families.
Today, Illinois Valley Community Hospital is an integral part of the community. IVCH is one of the largest employers in the area and is committed to providing the best possible health care in a caring setting that is close to home. Over the last decade, IVCH has recruited a significant number of talented new physicians. They bring a passion for their calling, but also the latest in medical training and an appreciation for new technology. The leadership of IVCH is committed to working with the physicians, staff, and volunteers at the hospital to honor the mission of IVCH. Illinois Valley Community Hospital is dedicated to providing exceptional care through a commitment to clinical excellence and compassion for every patient, every day. Hospital CEO Tommy Hobbs explains this everyday approach.
Well, I think that the community is as supportive of the hospital as the hospital is supportive of the community. We feel very fortunate to be here to provide care, and I think our community also feels fortunate that we're here to provide that care. They know that we're focused on them. We want to work with them to keep them healthy. We want to be here to provide the best care possible when they are sick, and we want to be the best we can be for them.
The main challenge facing IVCH today is the construction of the third floor on the East Addition. When the first phase of the East Addition project was completed in 2003, it included a new emergency department, a new surgery unit, a new admitting area. The master building plan calls for an addition on the third floor. This will address the two most pressing needs for IVCH, the construction of a new obstetrics unit and a new intensive care unit or ICU. The new OB unit will encompass 10,000 square feet and include 6 postpartum rooms, 4 labor, delivery, and recovery LDR rooms, a nursery and surgical room for performing cesarean sections. Jamie Bazidlo is a high-risk pregnancy patient who had a C-section at IVCH. She loved her nurses, but not her room.
Even though it was a rather trying time for my husband and I and my family, the staff at IVCH was very willing to educate us and help us out and make us feel very comfortable in all of our stays that we had here. The only negative part of my stay here at IVCH was the crowded area of my room. My husband wanted to stay with me because I had a C-section. I stayed 4 nights, and he had to sleep on a reclining chair, and I know that was very uncomfortable. And I know one of my friends who recently had a baby, she had a maternity suite at the hospital she stayed at, and her husband had a pull-out couch to sleep on, and the room was a lot more spacious and updated, and her stay was, you know, probably more comfortable than my stay here at IVCH because of the extra room and area to move around in while she was healing.
An OB update is critical, in the opinion of Mary Armada, Obstetrics Unit Nurse Manager.
Our OB department is at a very old part of our building. So yes, it is outdated. In our new unit, we'll already have that staff in place, but we'll be able to better accommodate women and their families. We have a great staff of midwives that offer options to the women of the Illinois Valley as far as their birth experience. You know, you can have a physician deliver your baby or a midwife. We have midwives who are going to be doing tub births and hypnobirths. So there are just so many options here at Illinois Valley Community Hospital that you can't get anywhere else.
The other major component of the building project is the new intensive care unit. This is an area that is badly in need of expansion and updating. Larry Barr had neck surgery at IVCH. He says his nursing care was great, but not his room in the ICU.
The staff was just absolutely wonderful. They took care of all of my needs, anxieties. There was not one person in the entire staff that had any negatives. They were always joyful, professional. The only negatives that I found at my stay here at IVCH was the ICU rooms were too small. My family did not have enough room to sit down. There weren't enough chairs. There was not enough room. The nurses had to have the family removed to complete their procedures.
A new ICU will be especially important in the years ahead as our population ages. These improvements were all part of the master plan. However, they require a significant investment on the part of IVCH. The total cost is $15,500,000. The majority of funding will come through hospital reserves and prudent borrowing. To close the gap between the total cost and the amount available, the staff and volunteer leaders of IVCH have launched a capital campaign. It is called IVCH for a Lifetime of Care campaign. Dr. Ed Fesco is a longtime member of the IVCH staff and currently serves on the campaign cabinet. He explains the significance of the campaign name.
I've been a doctor here since the late 60s, and I've seen a lifetime of care during these years that have intervened, and I think that's a perfect idea for our campaign for a lifetime of care. We've done a great job all these years, or the years that I've been here, and I've seen everything kept up to par, and now we need to do a little more to develop our obstetric department and our ICU to maintain the high level of care that we've always given and to face the future with the best tools at our command.
Illinois Valley Community Hospital is your community hospital, and we need your support. This is a project that will benefit not only you, your family, your friends now, but also future generations of your friends and family. We want to be here, ready, with the best care for you, and we need your support.
As we move forward with the IVCH for a Lifetime of Care campaign, I invite you to join us. We, along with our community partners, are committed to providing quality care and service for every patient, every day. Thank you.